what is hemifacial spasm?
This is a very good question. Hemifacial spasm means one half of the face contracts repeatedly.
Do we call this also as a winking disease?
These contractions are repetitive, they are uncontrolled, and they come and go in between. In 95% of the patients, it would start with blinking of the eye.
And ये जो हम कहते हैं ना आंखें फड़कना, जो मुझे भी actually अभी भी हो रहा है मुझे.
Everyone gets blinking sometime or other.
Yes.
You know, all of us have experienced it. That is not hemifacial spasm. Is a person who had come to me from Mumbai for treatment. He was standing waiting for a bus on a bus stop, and he had attacks of spasm. There was a lady who was standing next to him, and she thought that he is winking at her. And because of that, he was beaten up at the bus stop.
Hello and welcome to today's podcast. I'm Dr. Tushita, and today we have with us world famous brain and spine surgeon, Dr. Jayadev Panchawagh. Sir,
Hello.
Welcome on today's podcast. So the name Dr. Jayadev Panchawagh needs no introduction in the medical fraternity. But for the non-medicos, I have specifically jotted down some points and I would want to say that. 30 years of experience, 10,000 plus brain and spine surgeries, 2,700 plus MVD surgeries, chairman of Synapse Brain and Spine Foundation, founding member of Neurosurgery Focus India, the Indo-German Foundation. His brain tumor treatment center alone has operated more than 3,000 complex brain tumors. Trained from national and international institutes of importance, his team operates on patients from all over the country and the world, including UAE, US, UK, Africa, and Asia. What a wonderful journey, sir. What do you have to say about that?
First of all, very happy to be here with you. And yes, it has been an incredible journey of more than 30 years now. And I feel that we are extremely fortunate to be in this field, to be able to make changes in people's lives, positive changes through our work, through science, and through human skills. Really very happy to be here with you today.
We are fortunate enough to get some time from you, and today we are going to talk about something which is very special and a very important topic.
Correct.
Which is hemifacial spasm. So, sir, let's start with something very basic. What is hemifacial spasm?
This is a very good question because people do not know what hemifacial spasm is. And that's why it starts from there. You know, I will come straight to the subject.
Sure.
Hemifacial spasm means one half of the face contracts repeatedly. Okay. Spasms means continuous and repeated contractions.
Achha.
So suppose someone has hemifacial spasms of the right side of the face. Okay. Imagine that. So it will look something like this. You see this?
Do we call this also as a winking disease?
Yeah, I will come to that.
Okay.
But you see this movement?
Yes.
Continuous movement. It is uncontrolled. The person doesn't have any control over that.
Okay.
A person is speaking to you and suddenly while speaking, he will get these movements.
Okay.
Hemi means half, facial means face, and spasms means contractions.
Achha.
So these contractions are repetitive, they are uncontrolled, and they come and go in between.
Okay.
Initially, they start with eye twitching or winking, as you said.
Achha.
So it would look something like this.
Okay.
Then it spreads to the cheeks, and then the entire face and the superficial muscle of the neck, which is called as platysma, that also gets involved because it is also supplied by the facial nerve.
Achha.
And that's why you get something like this.
So, sir, is ये जो particular condition या फिर जो disease है, does it always starts with blinking of eyes, or are there anything else which comes before this?
In 95% of the patients, it would start with blinking of the eye.
Achha.
On one side, again, I'm
Achha.
repeating this.
One side.
Two sides never blink simultaneously. That is
Achha.
not hemifacial spasm.
Achha.
In hemifacial spasm, only one eye, either right or left,
Achha.
it will blink. Initially, the person will think, "Arey, ye kyun blink ho raha hai? Why is
Achha.
the eye blinking?"
Sir,
And
is this
then-
blinking and ये जो हम कहते हैं ना आंखें फड़कना, जो मुझे भी actually अभी भी हो रहा है मुझे. So you know, my this eyelid is continuously. I feel like there is something.
Correct.
is this hemifacial spasm?
So yeah, it's a very good question. It's a good question because so many people get this fluttering,
Yeah.
blinking in between. Everyone gets it,
And
right?
then, I mean, thanks to our Indian society, हम तो बोल भी देते हैं बाई आँख फड़कना अच्छी बात है, दाई आँख फड़कना खराब बात है.
Correct.
So, I mean, is this also one of the predisposing signs?
No. See, the thing is, everyone gets blinking sometime or other.
Yes.
All of us have experienced it. That is not hemifacial spasm.
Yes.
तो कभी कभी ये फड़कता है, हर एक का फड़कता है.
So
But
that is not.
that is not hemifacial spasm, but it starts with that.
अच्छा.
People start getting like this.
Okay.
क्या होता है कि when we get blinking like this,
अच्छा.
it goes away after some time.
Hmm.
In these people, it keeps on repeating like
Acha.
this. Then after a few months, it spreads here.
Acha.
Then it spreads. So it's a progressive thing.
Correct.
Another thing you have to remember is that lower eyelid you cannot voluntarily contract it.
Yeah.
You can voluntarily contract the upper eyelid
to certain extent.
but repeated contraction like this tuck of the lower eyelid, it's something which is
तो सर ये होता क्यों है basically? Is it genetic, hereditary?
So होता क्यों है is a good question. You know why? Because therein lies the key or the answer to its cure.
अच्छा.
तो क्यों होता है इसके 5-6 रीजंस है. लेकिन जो कॉमनेस्ट रीजन है, the commonest cause of this problem is what is called as neurovascular conflict. Achha. Now this word appears very big, but I will try to make...
I think you'll have to break it down for our viewers.
I will break it down because it is one of our aims of Synapse Brain and Spine Foundation is to demystify neurosurgery for the public. And it is one of our aims. So it is our job to demystify it. Okay. So in neurovascular conflicts, okay, listen carefully. What happens is that the nerve which comes out of the brain, blood vessel is in very close contact with the nerve. And the pulsation of the blood vessel continuously hits the nerve. Something like this.
Achha.
Okay. And this continuous hitting of the pulsations of the blood vessel causes changes in the nerve.
Achha. Okay.
And the nerve becomes more sensitive and it becomes very, very prone to misfiring.
Achha. Okay.
And that is when it starts misfiring. Okay. So basic cause is the blood vessel and nerve contact, which is abnormal in these people, and continuous hammering of the pulsations. So the nerve starts firing. When this happens with facial nerve, abhi facial nerve ka function kya hai? What is the function of facial nerve? Facial nerve function is to move the face.
Yeah.
So when this nerve fires, this will happen because it is like
over-triggered is what
over-triggered.
Yeah.
It is like short-circuiting and something like this starts happening. So this is what is called as a neurovascular conflict.
Okay.
So there are two things that have to be present for this to happen. First, in that particular patient, the nerve has to be particularly prone to this, genetically. Achha. And secondly, there has to be a blood vessel. I'm trying to say this in simple words without using too many of, complex jargon. So in short, the answer to this is to separate the contact between the nerve and the blood vessel.
So that continuous trigger, you have to stop. I mean, put something between these two.
This procedure has the potential to cure it completely. So when we come to the treatment part, I will explain more.
So sir, this condition.
But let me finish.
Yeah.
There are some other rare reasons for hemifacial spasm, but they are rare.
Achha.
Less than 1%.
Achha.
One such reason is tumor. A tumor occurring in the vicinity of the nerve area, which is called as root entry zone, can cause this sometimes.
Okay.
Or neurological disorders like multiple sclerosis.
Okay.
Or post-Bell's palsy. This can happen, but they are rare causes, and we rule them out with history before we suggest treatments. I would say 98 to 99% of the patients will have neurovascular conflicts. Achha. And it is eminently treatable and curable if it is done by the right team. So this is a message that has to reach people who are suffering from,
Actually, that brings to the next question of mine. So before I invited you for this podcast, I met a few patients of yours. I spoke to them.
You had come to the...
Yes. I met a few patients of yours and I spoke to them. And surprising enough, almost all of them told me that they never knew that this is curable at the first place.
Correct,
They said
correct.
कि ये तो होता ही रहता है. I mean, they have seen in past also. They are elderly people,
Some of them
having
are elderly,
yeah,
sure.
yeah. So they never knew. So why is it such a misled information, and why people are, perceiving this so wrong?
See, the reason for this is that a few years back, this problem was not treatable, first of all.
Mm-hmm.
Secondly, the surgery for it, there's a neurosurgery, which is a deep brain surgery,
Mm-hmm.
was not as safe as it is today.
Mm.
And secondly, I don't think there are many dedicated centers
Mm.
where this treatment happens in a focused manner.
Acha.
As I'm very happy to say that we have been able to do this over the last 21 years. Our MVD surgery center for
Mhm.
hemifacial spasm
Mhm.
is now in 21st year.
Oh, wow.
And to the best of my knowledge, there is no such focus center. See, what happens with the focus center is that when you treat such rare problems and difficult problems,
Mm.
the efficacy of the surgery
Mm.
increases if you repeatedly operate on these patients.
Correct.
If you carry out research while you are
So your
doing
focus is
this.
only on that. So it is more
So
focused approach.
in that center, our focus is only on that. So hemifacial spasms, other problems which occur because of NVCs, etc. We will come to that afterwards.
Uh-huh.
But such a focus center has the potential to give good results.
Mhm.
This is not a question of bragging. This is
Mhm.
a question of developing a tertiary care team,
Mhm.
because we have also developed patient support groups. We have developed people who are doing research in this problem.
Mhm.
We have acquired the best technology
Okay.
in the world,
Okay.
anywhere in the world. Whatever is available, we have it to treat these problems, like best endoscopes, best neuromicroscopes. While doing the surgeries, when required, we do the neuromonitoring,
Mhm.
and so many other gadgetry is there.
So that is the treatment part that you
Yeah,
are talking right
yeah.
now, sir. But before that, I have a
Yeah.
few more questions. Basically, I wanted to ask that is there any way that this can be cured at home or during the initial phases? If you take certain precautions and measures, then you might not need a surgery at a later end. Is there anything like that?
Unfortunately, no. The answer is no.
But it worsens over a period of time, right?
It definitely worsens over the period of time. However, during first few months
Mhm.
or first few years,
Mhm.
some people feel that their problem has suddenly vanished.
Acha.
What happens here is that body tries to repair.
Okay.
Body tries to repair the damage
Okay.
done to the nerve by the
Mhm.
blood vessel by producing more and more myelin.
Hmm.
So it tries to repair it. So it can disappear for some period of time.
But not permanently.
No, we call it spasm holiday.
Acha.
So if it is long enough, the patients feel that the problem has disappeared.
Hmm.
And in fact, I have come across few clinicians also,
Mhm.
because of this spasm holiday,
Mhm.
they have got a notion that this problem can spontaneously disappear.
Acha.
It does not.
So it
There are-
might
there
go
are-
away for a certain period of time, but it will surely come back.
It will surely come back.
Hmm.
There are anecdotal reports
Acha.
that some of the hemifacial spasms have permanently gone.
Hmm.
So it is an exception. It is extremely rare.
Hmm.
It is a progressive disorder,
Hmm.
and it creates a lot of havoc in the life, and it needs definite treatment.
Mm-hmm. So, sir, though this eye winking or eye twitching, we call it as, it is definitely a social embarrassment kind of a thing. I do,
Oh,
do
surely
definitely.
it is. Yeah.
But does it also impact the overall quality of life of a person who is going
Absolutely,
through it?
absolutely. Just imagine. You have met so many patients.
Yes.
In our center. Just imagine a person in his or her 30s
Hmm.
and who has hemifacial spasm. He cannot get a job. He cannot get married.
Correct.
He cannot go in the society. He is ridiculed.
So it not
And-
only impacts your physical health, but also takes a toll on your mental health.
Yes, it is psychologically extremely embarrassing condition, and it involves your life in a very big way. Okay.
So
And
once a person feels like, understands that he might be going through this, and comes to you. So, what are the initial diagnosis done for this to diagnose that this is a case of hemifacial?
So first of all, it needs good history taking, because there are a few conditions which can mimic this.
Acha.
So a person who is experienced
Mhm.
in hemifacial spasms
Uh-huh.
should take the history to diagnose that it is in fact hemifacial spasm and nothing else. Secondly, once we are sure that it is hemifacial spasm, then we need a special type of MRI
Mhm.
wherein the facial nerve is examined in detail in that
Okay.
MRI through different studies, different protocols. And along with that, we also get the MRI studies which are required for planning the surgery.
Acha.
So it's a full study that we get done,
Okay.
and
So-
it is pretty enough to diagnose the whole thing.
Okay. So as you said, sir, that it kind of mimics a certain things. So this hemifacial spasm, does it also mimic some other condition which people might get confused
Yes,
with?
sometimes because we have given good results in the range of 99% cure rate, some people think that all the facial problems can be treated with this.
Okay.
So which is not true. For example, some people get continuous blinking like this. You look at my face, something like this while speaking. You must have come across some people.
Yes.
When I'm talking to you,
Haan.
both the eyes are
They
blinking.
keep
This is not
blinking.
hemifacial spasm.
No.
So that is why people come with hope. So they come with hope, and then we have to tell them in such cases that no, this is not hemifacial spasm.
Acha.
And there is, unfortunately, till now there is no surgery available for this. So that's why I said history taking
is very crucial.
Examination is very crucial. And the first investigation with MRI, I want to make one thing very clear about the MRI. This MRI is not a normal or routine brain MRI. It is a specific MRI which is aimed at studying specific things for diagnosis, and should surgery be required, to plan the surgery in a proper way.
Okay. So, sir, as you just now said, right, if the surgery is required, then only we go ahead with it. But then what are the first line of treatment or second line of treatment? How is hemifacial spasm usually treated? I mean, is it sure shot that the patient has come with the condition and we straight away go for surgery, or how is it?
See, the thing is, after all, it is brain surgery.
Anji.
So people have to be educated about the surgery, and they have to be told that in today's era, this surgery can be done safely in a center like ours, because we are focused on this. And here the patient support group is very important. So what is patient support group? So patient support group means patients who have suffered from a particular problem, they have got cure, their life is changed, and they speak with these people. World over, there are patient support groups for cancer, for heart problems, for neurological problems. Similarly, we have patient support group for hemifacial spasms. So it is very useful, because they get this mental strength when they hear.
Yeah, because when it comes to brain surgery, or the term like brain surgery, that kind of intimidates anybody.
Correct.
So a support group plays a very important
and
role.
They have to be told in a proper perspective. They understand.
Yes.
If you tell them properly, they understand. किसी ने बोला अरे अरे वो तो ब्रेन सर्जरी है, वहां पे मत जाओ, ये बोलना इजी है. It is very easy to say that. But then you tell them what to do then. If
वहां नहीं जाना है,
वहां नहीं तो जाना है, तो कहाँ जाना
है, और वहां पे कोई गया है क्या पहले?
अभी दूसरा जो है ये हेमिफेशियल स्पैस्म में जो ट्रीटमेंट लोग बोलते हैं, वो एक्चुअली क्यूरेटिव ट्रीटमेंट नहीं है.
अच्छा.
वो जो ट्रीटमेंट है, इट इज गिविंग अ पर्टिकुलर chemical. They inject it.
Okay.
It is a toxin derived from a bacterium.
Achha.
Okay. Now normally this bacterium toxin causes paralysis of the muscles, and it causes disease. So they have harvested this toxin from the bacterium, and that is injected in various muscles. So what that does, it paralyzes the muscles. Okay. So for some time, 3 months, 4 months, the muscles stop spasming, but they also become paralyzed partially.
But that's
you understand
not a
that's not a solution,
that's
because
not a solution.
because the blood vessel is still hammering against the nerve inside.
Yes.
So it is like
It's
saying
just that
that
because the muscle is paralyzed, it is not able to reflect
yes,
there.
it is not seen.
Yeah.
So, to get such treatments done temporarily is all right, but to do it repeatedly, it has got its own downsides. Over the period of time, it stops working, the duration reduces, there can be, other risks involved with that, like allergies, etc. So we are not, as a team, our philosophy is not in that direction. Our philosophy is to cure this permanently. Temporary solution, incomplete solution with the basic problem increasing inside is not the answer. So I will give you an example. Suppose somebody has got a liver abscess. Okay, there is abscess in the liver.
Okay.
पीप हो गया है लिवर के अंदर और फीवर आ रहा है, तो अगर तुम क्रोसिन दोगे तो फीवर जाएगा, लेकिन वो ट्रीटमेंट नहीं है,
वो लिवर को थोड़ी ठीक कर देगा,
वो लिवर को ठीक नहीं करेगा. फॉर दैट you have to aspirate the abscess.
Correct.
Abscess निकालना,
treat that. Correct.
So similarly for hemifacial spasm, जिसकी वजह से hemifacial spasm हो रहा है, वो ट्रीट करने की जरूरत है. So apart from that, unfortunately, there is no other treatment which has got potential to cure it permanently. So this is what we have to educate people about. And it is my experience that if people are told properly, with scientific knowledge, with our experience, with patients' stories and patients' support groups, they understand. Because obviously, one who is suffering always tries to find the best answer for himself or herself.
Correct.
Our insistence is that people who are not experienced in this, people who have half information about this, people who are biased only about one type of temporary treatment, should not tell them things which are not scientifically correct.
I also believe, sir, that this is a very important element because right now the internet is flooded with information.
Correct.
And more than guiding you right, it misguides you. So if
it could misguide you. It could misguide you, but it has potential to guide you properly also.
Yeah, but then who tells you that this is the right guidance or this is the wrong guidance?
Correct.
So for that, I think a proper guidance and awareness, which the support group which you
So
suggested.
that is where the support group is important.
Yes,
because when you speak with 3 or 4 people who have undergone the treatment, they cannot give you wrong information because they have been cured.
And this is something which you cannot give a wrong information because it will be seen.
Absolutely.
It will be seen from the people you are talking about.
And you see the people in our support groups. They are professors, they are actors, they are very highly respected people. And they will give only true information and correct information to any new person coming. So 2 months back, we got a patient from Dubai. And he was in 2 minds. He spoke with me. I told him everything. But when a person, a professor at a national institute, we had treated him. When he spoke to him, it was easy for the patient to understand because that figure is highly reliable in his eyes. Okay, and very analytical and logical person telling him that he has undergone this treatment. And these people in patient support groups do not tell any emphatic thing. For example, I got cured, you also get operated. No. They only tell them that this is our experience, you take your decision. So this is the logical guidance that should come, So there is no bias in this.
So, sir, tell us about some interesting cases of hemifacial spasm that you have encountered.
Clinically interesting case that I remember about hemifacial spasm is a person who had come to me from Mumbai for treatment. And his story was, in a way, very sad actually.
Achha.
He was standing waiting for a bus on a bus stop, and he had attacks of spasm. There was a lady who was standing next to him, and she thought that he is winking at her.
Achha.
And because of that, he was beaten up at the bus stop. Now, it is a sad story. He came to me and he told this story to me.
So much of embarrassment.
And that was the time when I realized that, I can make such a difference in this person's life with this surgery, for which, we have been, working for a
Such
long
a
time.
close
Yeah,
knit
for
for
such a
such a
long
long.
time.
So, sir,
And
total 700 plus MVD surgeries so far by your team
for hemifacial spasm,
for
the
hemifacial.
total number of MVD surgeries we have done has crossed 2,700.
Okay.
But that
So for
includes
hemifacial
different disorders. So
Okay.
for hemifacial spasms, it has crossed 700.
700. So 700 plus MVD surgeries for hemifacial spasm. What keeps you going, sir? And one more question which I wanted to ask you very specifically is like, your department of brain and spine surgery is so huge. What motivated you to pick only this, niche expertise?
No, we have different types of specialty centers. For example, we are also focused on skull-based brain tumor surgeries.
Okay.
But this particular niche that I
What
picked up.
motivated you to do
So
this?
the case that I told you,
Correct.
life stories like this,
Making a difference in
making
somebody's
making a
life.
difference in someone's life, because somebody, and nobody seems to understand their problem. Somebody who is having hemifacial spasm, nobody seems to understand their problem. I
Correct.
operated on a lady of around 76 years of age who came from Canada.
Acha.
And she was repeatedly told by the neurologist there that your age is too advanced and you should get only temporary treatment done. She refused. She says, I have social life. She came to me and said that, doctor, I am not asking whether surgery is
Whether I should
required
go
or not.
ahead or not.
Yeah, I
Okay.
want it done.
Okay.
And that time I understood that these patients are suffering socially so much.
So much.
And she was cured and she is happy. And these are the stories which keep us going. It's change in life, complete life change, because someone gets a job, someone gets married. There was a lady from a different country who came to us, who got divorced because of this problem.
Oh.
And recently that lady also started her new life.
Okay.
So these are the stories which give us strength.
So
which
making
give
a
us,
difference in somebody's life.
especially for a problem which appears to be unsurmountable to people,
Correct.
is what keeps us really going.
Great, sir. So it's so inspiring to hear all these stories from you. So, sir, before we end this podcast, my last question to you would be, what message do you want to give to people who are suffering from hemifacial spasm, to them, to their families? What would be your message?
So the message that I would really like to give to everyone who is suffering from hemifacial spasms, or if your near and dear one is suffering from hemifacial spasm, or should you happen to see someone suffering from hemifacial spasm, please be informed that in most of the cases it is potentially curable, that there is a center of excellence that exists in India. We can help you. And also we have put lot of material on net for patients education. So if they go to the YouTube channel, see a whole list of videos on hemifacial spasm, wherein they will get the information. So please do that. There are few neurological problems like movement disorder problems which can be cured, and this is one of the problems.
Those problems.
And that's why you have to really educate people more and more about this.
Thank you so much for sharing this inspiring story, so much of information on hemifacial spasm. I'm sure many of our viewers will have a lot of benefits out of this podcast. Thank you so much once again for coming to this podcast.
Thank you for calling us and giving us opportunity. I consider this as work of our organization, and thank you for this great dialogue.